Botox is the name of a brand of botulinum toxin which is injected into the muscle to relax. Relaxed muscles do not contract, hence wrinkles are not visible. Although Botox is a toxin, when medical practitioners use it correctly in a small amount, then it can have much payback. In little doses, it can reduce skin wrinkles and help to treat few medical situations. This toxin is derived from natural things, so it is safe in a certain amount, but a large amount of toxin can do harm to the skin. If by mistake you get a high amount of such toxin, then your face structure can be changed. Certain mishappenings can be there with too much Botox. Over-injected toxin makes your look dissimilar. Your face will not remain the same after getting Botox treatment if the right amount of toxin is not injected into the area. It can change the shape of the muscles and face as well. Too much Botox can erase your natural beauty. When your face gets to change its shape, then your natural beauty will automatically be altered. Globular and puffing cheeks. If too much toxin is put into your cheeks, or the Botox is injected in the wrong area, then your cheeks can bulge, and nobody wants to have rounded cheeks. With these puffed cheeks, the face look deformed. As a result, makes the eyes and jawline look smaller comparatively. Abnormal flabby lip. Plump lips are possibly the most palpable sign of too much Botox. For instance, if the top lip is injected with too much toxin, results in the too large upper lip as compared to the lower lip. Actually, what happens, when you receive Botox, your lips are stretched out, and getting toxin frequently gives the stretched tissue. Uneven facial features. A common sign of overdosing on Botox is that your features are not in proportion. It possibly will be your lips, cheeks, chin, or forehead. You will lose your natural beauty and have to remain with uneven features. Floppy eyelids. According to Botox experts, you should never inject the area close to the orbital bone right over the pupil. If this happens, then it can glide down towards the upper eyelid and results in drooping of eyelids. This effect can last from several weeks to months, and the purpose of getting Botox will not be retained. Freezing face. The biggest fear of getting Botox is of getting the frozen face. People who did not receive the appropriate amount of toxin can result in a frozen face and won't be able to move their face. If you are injected by an experienced provider, then this case is very unlikely to happen. To conclude, for getting the desired result of the treatment, you must opt your medical provider who is an expert and has experience with Botox injections. What amount of Botox is considered too much? Botox normally comes in dosage ranges from 50 to 100 units per vial. Every unit measures the effectiveness or potential of the Botox to work for your appointed result. According to the report of the American Osteopathic College of Dermatology, the botulinum toxin is extremely hazardous if not injected with the right amount. The number of units of Botox is different for different patients. Your provider can tell you better after examining your treated area and physical condition. Most of the Botox experts follow certain guidelines as a starting point and modify a treatment plan for each patient. A definite number of units is required for different areas of the face. For instance, an average of 10 to 30 units are to be injected to diminish the forehead lines. More than these prescribed units will result in harmful effects. How do you know if you're getting too much botulinum toxin? This is the question in everybody's mind, that how they will come to know that they received a higher amount of the toxin. Although it is a 2 to 3 minute procedure, the complete result of the treatment can be seen in 7 to 14 days. After this number of days, if you did not get the result for which you treated yourself, means that there is something wrong with your toxin amount. The first and foremost sign is that you got your cheeks bulging out than your natural looking. Secondly, if you are not able to move your face in different directions, then certainly you got a high amount of Botox. Moreover, you will get a spot brow, which occurs when you get more amount of toxin into the center of the forehead than on the sides. This results in an unnaturally low brow with a high tail. This makes it obvious that your Botox was not done in the accurate amount. Can too much Botox be risky to you? We all know that too much of everything is dangerous for our health. This remains the same in the case of Botox too. This is a cosmetic treatment, and obviously, some negative impacts must be there. Most of the side effects of Botox go away over time, but if the correct amount of Botox is not injected into the correct muscle, then the effects can be health hazardous. The purpose of the treatment is to paralyze the muscles temporarily for 3 to 6 months. Repeated injections and large amounts can cause permanent paralysis of the muscle, results in unbalanced facial expressions. Too much Botox toxin can extend into the nearby tissues and can prove to be serious. All in all, to avoid becoming the tragedy of bad Botox, Our suggestion is to go mild with smaller doses of Botox, particularly if you are new to getting neurotoxin treatment. Because weird facial expressions are one of the serious giveaways of Botox.